the hot commodity these days, as the kids say, is the N95 mask,
Mhm.
which is a mask that like basically creates a seal around like your chin and above your nose. Um, we in dining services, housekeeping, and most of the nursing staff, we don't get N95s. We get surgical masks, which is like the white and blue. Like they kind of look like cloth masks. You'll see them a lot on Grey's Anatomy. Um, and they're surgical masks, so they are like surgical grade sterile masks. But they went around and gave everyone one, and they said, we want you to use this as many times as you can before it's like dirty and unusable, and then we'll give you a new one. Which I understand that there's like a supply, like a huge demand and a very limited supply. But with a mask that I have worn for 8 hours every day for the past 2.5 weeks, I feel like it's no longer sanitary. When we ask for one, they have us like sign a sheet and sign one out. It's a weird process. I just feel like it's so unsanitary, and like at this point I just have a piece of cloth across my face. It's like just there for show. It's definitely contaminated with something. I don't know what, but it's contaminated.
Are you frustrated more with like the situation, or is there something that you feel the hospital could be doing better?
I'm insanely frustrated with the whole situation. But if we're going to focus just on the retirement home, I'm very frustrated with management, because the place I work has been open 55 years, and they didn't have a pandemic plan at all. You know, in like 50, however many years working with like a large community of immunocompromised older residents, no one took 5 minutes to think like, hey, maybe we should have a plan if this happens. And like just their lack of preparedness, that's like the biggest thing that's frustrating me. Because a lot of the times if I will have like very what I consider to be very simple, like straightforward questions, I will go and I'll ask my supervisors or my manager or my boss, and they won't have an answer for me. And it's just like it became very clear pretty early on that everyone was flying by the seat of their pants, and that it was going to be a long haul.
Marissa mentioned a video update from your work that you had some thoughts about.
Yeah, I just got it this afternoon, and one of my coworkers is texting me about it now. Um, we got a video like training seminar thing from my manager. It's just like mask information, um, and in it they said like, you got this mask. Here's how you wear it. Here's how you take care of it. But she also talked about how dining services and housekeeping. The person in the video, who I've never seen before, so I don't know who she is or what department she's in. She said, we don't go into high risk areas, so we don't need a surgical mask. We have one, but we don't need it. Which it's not true. We are required to go into high risk areas, literally required, or we will be like punished. I think a lot of my issues come with the fact that it highlights the fact that upper management has no idea like what we do or how we run like our stuff. It showcases like how disconnected they are, from their own employees, and how beneficial it would be for them to like come in and listen to us, as opposed to them coming in and telling us what to do. Because a lot of the times when they come in, they'll see like they will watch us do our stuff for like a day, and then the next day we will receive like a list of things that we need to change, and they won't provide like any reason as to why it needs to change. They won't ask us like, hey, why do you do this way as opposed to this way. They'll just be like, you need to do this way now. And that leads to, first off, just a lot of confusion like that first day. The first few days actually, because people will like start doing it the usual way, and someone will be like, no, you have to do it this way now. And then that usually leads to like a 15-minute like hunt the manager down and ask her why, kind of thing. And then in the long run, it causes a lot of issues, because usually the former system would have been in place because it was like efficient we knew what we were doing. It was like the easiest way to get things done. And then like the new system, it will be like some like bullshit stuff. Sorry for the language. I don't know what
No, you're good.
rating
You're
we're
good.
going for here, but
X.
um, but she said that, and it just really highlighted the fact that like they don't know me and they don't know what I do. So why should I continue to put myself in danger? Oh, which also leads me to another thought. Before this all happened, I was like gunning for uh, not a promotion, but like a raise because I was full time, and I have like a lot of the responsibilities that I have are like supervisor responsibilities,
Mm-hmm.
and I feel like if I'm gonna like have those expectations and also meet them every day, I should have like a promotion. So I guess a promotion and a raise because I was being paid the same as like entry level workers, but I was held to a much higher standard. So I talked to them about it twice, and each time they told me it wasn't in the budget for the year. And then this happened, and suddenly everyone gets the raise that I was asking for, like months ago. And like I'm
Yourself
not mad.
included, right?
Yeah, and
Okay.
myself included. And I'm not upset that other people got the raise. I'm upset that that they told me that they couldn't do it, and now they can. You know, because like everyone I work with deserves this raise. Like we deserve a lot more than what we're being paid. But like I was asking for this, and they told me they couldn't do it, and now they can.
Overall, do you feel that the home has done a good job or a bad job of handling the situation? And what would you do differently?
So here's the thing. I think as a retirement home who had no pandemic plan, which that is something I would have changed. I would have had a pandemic plan to begin with. I think as a home with no pandemic plan, they've done a good job. A lot of retirement homes got a lot of COVID cases before we even had one in our employee staff or in our staff. Um, so I think comparatively speaking, we've done a pretty good job. Um, a pretty good job in relation to like resident safety. In relation to employee satisfaction, not so much, because a lot of people who have had like very basic questions, their questions have gone unanswered. A lot of employees who felt a lot of the people I work with and a lot of the people I talk to feel as though like we are not appreciated by Porter Hills. I got a weird voice message a couple weeks ago, and it was from, I don't even remember who it was from. It was some like upper management person who called me and left a voicemail, and the voicemail started off real creepy, sounded like a serial killer. But after that, like it was just saying, it was a voicemail saying like, hey, thank you for coming to work, we appreciate you. But I could tell it was so obviously she was like just reading off a script, and like I didn't know her. She very obviously didn't know me. She was reading off a script. There was like no intonation or inflection in her voice. So it all just feels very like a routine that they're performing. I don't feel like they're appreciative of any of us. Yeah, they're putting on the act, but you know, when I asked for the raise and the promotion for the work that I was doing beforehand, they told me no. Or when I asked them very basic questions about like, I asked them a question about like, we kind of had to cut back on hours because the workload that we're doing was basically cut in half. And like, I definitely get why we had to like roll back on our hours. I'm not mad at that. But I was asking them like, hey, if I can't meet my full-time hours this week, like, are you going to take it out of my PTO, or is this like a special case kind of thing? And they really couldn't answer me. And I feel like that's a basic question that you should be able to answer for your employees, especially the employees who work there full time and like this is their livelihood and this is the only reason why they can like afford to do anything. You should be able to answer questions about like their pay